Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be discussing peri-wound management for chronic wounds. But first, if you could hit that subscribe button, it would be greatly appreciated as it really does help my channel. So let's get started. So what is the peri-wound area? So the peri-wound is the tissue around a wound, okay? Now, this is kind of controversial, but it is 4 centimeters in all directions around the wound. Now, in a small wound, that might be quite big of an area, but in a larger wound, it might be small and the peri-wound might actually go further than that. That's why the controversy, but in general, it's 4 centimeters around the edge of the wound. So what causes peri-wound damage? So there are various factors that can come into play with peri-wound damage. So there's intrinsic factors, which originate from the wound, or extrinsic, which is harmful stimuli. So moisture-associated skin damage. This is coming from the wound, so it's intrinsic, and it's causing damage to that outer tissue. Injuries sustained from a dressing. This would be extrinsic. It's an outside force. Sometimes with that fragile skin, the dressings can cause damage. Medical adhesive skin injury. So the actual adhesive from the dressing can cause damage. Other factors that can contribute to peri-wound damage are infection, foreign body contamination, and repeat physical trauma. So if somebody has friction and shearing, if they're sliding down in a bed a lot. So more into moisture-associated skin damage. So when we have this, it's caused by fluids from our body. So either urine, saliva, sweat, mucus, stool, wound fluid. Okay, so that exudate. We have to be very careful and make sure that we are controlling the amount of exudate, because if we let it get onto the skin around the wound, it can cause the wound to get larger, become inflamed, be red, painful, itchy, pale. It'll become friable skin if left too long, so it bleeds really easily, and you will have worsened skin erosion around that wound, so the wound will get larger. Wound dressing related injuries. So sometimes if we're changing the dressing too frequently, especially with our dressings that actually adhere themselves, we got to be careful with how much we're actually changing that dressing, because it can cause damage to fragile skin. So our children and the elderly, they do have very fragile skin, so we have to be careful, because this will lead to inflammation, and when we have inflammation, it becomes very fragile skin and will have further complications. Next, we have medical adhesive related skin injury. So this is when we have a dressing that is sticking onto the actual wound. It might be the adhesive of the dressing. When we go to peel it off, it can cause that friction and shearing. It can even pull the skin right with it. So we have to be super careful when we're removing a dressing, because we don't want to cause more damage. And if a dressing is ever really sticking, we should be saturating it with our saline or sterile water to get it to release. You might have to wait 5-10 minutes. Just keep saturating it, let it sit. Saturate it, let it sit until it releases itself, because we do not want to be causing damage to our freshly new skin that's just, we might have had a dressing on for 2 days. We don't want to go back a few days by just tearing it off. So risk factors for peri-wound injury. So advanced age, okay, so either the elderly, and I do want to add children in there because they do have a very fragile skin. If we have drainage from, say, a fistula or a stoma that's just consistently draining, allergies, copious wound exudate, Okay, so a lot of wound drainage that's not being managed. Exposure to corrosive bodily fluids. Okay, so if somebody is incontinence, either of urine or stool, this is a huge factor and will cause sores just in itself. Previous trauma, so burns, shear injury. If you have had a previous injury at that location, it's going to be harder to heal. Okay, it's also going to cause more damage to the peri-wound tissue because it is once again fragile. And then just underlying medical conditions or diseases, skin diseases, eczema, psoriasis, irritant dermatitis, any of these put you at higher risk. So some signs and symptoms of peri-wound damage that you might see and you want to recognize right away, because the quicker we recognize this, the quicker we can treat it, management, and it has less chances of affecting the wound negatively, okay? So red or tenderness, okay, around that peri-wound. So pain, rashes, redness, any changes in the tissue. It could be white, so that maceration. Immediately, when you see these things, you know something's going on. You need to look at the whole picture. What is affecting this wound? What can we change to correct it? So when we are assessing the peri-wound tissue, there are some things that we want to look at. So we want to look at the location. We want to look at the shape, the temperature. Is it warm? Is it red? Is it inflamed? We want to look at the color for redness, inflammation. We also want to look at the actual wound itself, the volume of exudate. So if we have a lot of drainage coming from that wound, we know that this can cause and are putting us at risk for maceration. So we need to be looking at that and planning ahead and thinking, okay, what type of dressing, what type of technology can I use to protect this peri wound so the wound doesn't get larger? Okay, we want to close the wound. We want to help it along, not let it get bigger. So, how we're going to manage the peri-wound injuries. So, me personally, as a wound care specialist, I always say prevention over cure. I say this because it's so much easier to prevent something from happening than to fix it after it has already happened. And most of the time in wound care, the same things that we're doing to prevent it are the same things we're going to have to do to cure it. So we're going to have to do them anyways. We might as well do it and prevent the pain and suffering that the patient's going to endure from having these complications because they are very irritating. Okay. They don't feel nice. So prevention rather than cure. So what we're going to do, skin sealants, either the spray or the liquid. They come in like little foams that you can wipe around the peri wound, or a spray, and use the skin sealants if they are at risk. Use a more absorptive dressing, okay, to control the exudate. If you're noticing that there's a little bit of maceration starting, start something new. Use a more adhesive dressing, okay? I know that we don't want to dry out our wound, but we can't have it too wet either. We want it just like our mucous membranes. So like our eyeball or the inside of our mouth, that's how moist we want our wounds, okay? Um, just careful application. So if somebody has that very fragile skin, make sure that we're using a non-adhesive layer where that peri wound is. So at least the 4 centimeters around the wound should be protected by a non-adhesive layer. You can put an adhesive over that that stretches out beyond, but protect that peri wound tissue. Okay. We always have to be protecting the peri wound because that tissue is at most at risk for breakdown, and that means that wound will get larger. Okay. If a dressing is sticking, either use an adhesive remover. If you don't have an adhesive remover, then we want to be just saturating it with our saline or sterile water and letting it release itself. Okay, I've even had it where patients have called and said, look, like it's really stuck, it's not even releasing after 10 minutes. Go have a shower with the dressing on, as long as it's potable water. Okay, tap water that you can drink. You can saturate it in the shower. Just let the water flow over top the dressing and it should release it. Okay. And then also protective ointments and barriers. I really like to suggest this when somebody is incontinent, okay, either urine or feces. We want to make sure that we're covering the area that could possibly come in contact to prevent moisture associated skin damage, okay? So I hope this video did help you better understand the peri wound and how to manage the peri wound. But that's all I have for this video, guys, and I hope to see you in my next one. Bye.